My name is Sue Howard, and I'm just going to spend about 10 minutes sharing some of my insights with you about pathways into health and social care career. Just let me bring up the slides. So I work at NHS Greater Manchester, which is the Integrated Care Board in the People and Culture function as Head of Workforce Development. And I am hopefully going to share with you just some of my insights today in terms of my own career journey through the health and care system along the way so far, and give you hopefully some really helpful tips to help you onto the health and career path and perhaps help navigate through your career as you move forward, just from my experience, and providing some tools and approaches that you might want to consider and some resources that are available to us all. So the first thing to say is, historically, career pathways in the health and care service tended to lean towards being quite linear paths. So you'd start at the bottom and work your way up and spend your career in one particular space. And that just doesn't seem to be the case anymore. Many people chop and change along the way, do something different, and that seems to be increasingly the case in many organisations. And one of the things that we look at in our workforce development portfolio is, how do we retain people? How do we keep people in the health and care service? Things may change for them, they might want to do something different, but we want to retain their skills and experience and enthusiasm. So how can we keep them in there, but allow them to do something slightly different when things change or they want to try something new? Portfolio careers are also getting increasingly popular. If you use an example of general practice, lots of general practitioners now have steered away, or more of them have steered away from becoming a partner in their practice, and instead do X number of sessions per week, and then maybe have some additional responsibilities alongside. So, for example, they may have quality improvement interests, or they may have a leadership role, and they do this alongside their caregiving as a general practitioner. And that they have really paved the way for portfolio careers. Many other professions are also giving this as a greater opportunity now for people to not just change the journey along the way, but actually even in the working week, they might do a bit of a mixed portfolio, which is another great opportunity. So this is a infographic that we helped produce for some social care colleagues that we work with, just to give a bit of a snapshot of, moving your way through. How do we support people to see what opportunities there are available as they progress their careers? And this is just one snapshot of social care, but there are over 350 professions in health and care service. So the options really are almost limitless about what opportunities are available to people to move around and to do something a little bit different. For looking at it from a professional's perspective, one of the tools that I've been involved with developing over the last year or so is a recruitment and retention toolkit. This is for Greater Manchester, and it draws on lots of the national and wider resources, but also builds on a lot of the case studies we have from within our footprint, because we have some brilliant work that's been happening to look at different ways of approaching getting people into the health and care service, and how do we retain them better at the back end as well. There's also a national programme that is also resourced within this toolkit. You're welcome to have a look. I've included the link there, and it's really quite inspiring about some of the alternative approaches that people have taken to bolstering the numbers of people that working in health and social care. So when I was reflecting, preparing for this session, I was thinking about my own career journey and how can I share some of the learning from that journey that I've taken to help people either into health and social care or to help develop their careers as they move forward. So I've come up with top tips, just 5 of them, that really have been quite pivotal in my own career journey, and I think are key things that other people might want to consider on their own journeys as well. The first thing to say is that don't give up at the first rejection. It's often quite difficult to get into health and social care in some professions initially, but if you keep at it, you will get there. I considered myself to have done reasonably well in my career. I'm really proud of where I've gone to, but it could have looked really quite different because I absolutely bombed at my A levels, completely and utterly. And so I managed to scrape my way into university. I did biology, and the rest is history, really. So that was a really big life lesson for me. So I would say that, you may come across some hurdles, you may have some failures along the way, but do not give up. If you keep at it, you will succeed. There is help out there, and actually my experience is, if you do call out and say, can you help me, I really want to do this, I'm really enthused, people generally will help you. So if you do reach out, the help is there to get you where you want to be if you've got that interest. I've included a link at the bottom, linking in some of the national resources that are available to help you with your CVs and applications, etc., interview practice, etc. And I've also included a link to the recruitment events that I mentioned, because there are some great tips for professionals there about how we might do this better, and how we might get some of the local people, local populations into health and care service that may not have considered or been unable to get into the sector so far. There's some really brilliant ideas about how you can remove some of those hurdles that are there for people, relatively easy to open up this world of opportunity. My second top tip is to do what really interests you. So when I finally achieved my degree, I decided that I really fancied doing some laboratory work because I really love the practical side of my degree. And once I started a job in research, I then realised that I really missed the infectious diseases element of my degree. So I decided to take up clinical scientist training. I didn't get there first time, had to apply a few times, had to battle at it, but I got on there, and I had several years of absolutely loving clinical science. I really loved that. I had such a good time. And I think that my reflection on it is, and this is along the way, if you're doing what interests you, you're much more likely to succeed. They do say that people that are experts in the field, people that win the Olympics, become, internationally renowned musicians, whatever their profession might be, that those people have put 10,000 hours in to become experts. So the more you put in, generally speaking, the more likely you are to get where you really want to be and to maximize your potential. So I was definitely doing what I loved at the time. Then I had one particular year that was a really challenging professional year. Just lots of things collided at once. And I came out of it a different person. And my reflection was that I didn't feel that I could wait 10 to 15 years for somebody to retire to get where I wanted to be. I was ready for progressing, and I would just have to wait because of the nature of the beast till that people moved on, to people retired, until I could progress in my career. It was one of those jobs for life. So I spent about 6 months wrangling about it, but I actually did leave clinical science. It was so unheard of at the time. Someone from the national team rang me up to say, why are you leaving? But I took this massive leap, what it felt like to me, to leave clinical science and to do something really different. And so I went into research and did some translational research for a number of years. It was really scary, leaving behind my career for life, my comfort blankets, my knowledge base, and do some stuff that felt really scary, but it was a brilliant opportunity, and I never looked back, and I'm so glad I took the plunge. I traveled the world sharing my data and had some fabulous experiences and built up some amazing skill sets. So yeah, definitely don't be afraid to take the plunge and do something different if it feels like the right thing to do. Then acknowledging that things can change again. And several years down the track, I was reaching my late 30s, decided we wanted a family, and therefore commuting at that time for 3.5 hours a day and doing 48-hour experiments through the night seemed a bit less appealing. So it was time to adapt, to change, and to do something different again. And so at that point, I decided coming back into the health and care service more directly was what I wanted to do. I had been doing research to support clinical care, but I wanted to be closer to making improvements in health and social care directly. So I worked for an organisation that was the connector between academics and health and social care, and did lots of implementation and evaluation. And that, again, that was a brilliant experience. And I had adapted to my own personal circumstances changing, but it gave me a whole raft of new experiences and skills to build on. And again, that was a scary experience, leaving behind that knowledge of that particular specialist area that I'd been working in by then 15 years. But it was a brilliant opportunity. And again, I didn't look back. And finally, and this is where I suppose I am at the moment, is I've now working at a system level, a system leadership, and I have pieced together all of those experiences that I've had along the way, all of those lessons learned, and now work in a team, and I bring that wealth of skills and knowledge, experience, and the networks that I've built up along the way as well to the team that I currently work in. I've got a really mixed team. I work in a people and culture team. There's obviously a lot of people that work with a HR background, organizational development, but we've got people that are parliamentary background, obviously clinical science, research, physiotherapists, people that worked in local authority. There's a real range of people, and I guess it's just to frame the opportunities out there are huge, and you may be unaware at this point where you might see yourself in 2-3 jobs down the line. But there are really varied roles out there that are looking for people that have got varied backgrounds and varied experience to bring to a mixed team. And I have so far had a brilliant career trajectory. I've enjoyed every single role that I've been in. I've enjoyed every single role that I've then moved on to. It's been the right time to do something new. You know, who knows, watch this space in the future. I've got a few jobs left in me yet. But hopefully these top tips and my experiences will help you on your journey into getting into health and social care and progressing through it. There are almost limitless opportunities. As I said, 350 professions. You can chop and change, you can move around. Once you're in the health and social care service, you start to build up a network of people that you can call upon, that gives you those opportunities to do something different. It's really an inspiring place to work. It can be such a great opportunity to have a whole career in health and care service and give back also, which many of us have come into this in the first place to give back to patients and make it a better place and give people better health and a good life balance with their health. So I'll pause there. Thank you for taking your 10 minutes out to listen to my experiences, and hopefully some of these top tips have been really useful to you. Best of luck in your journey, and all the best for the future.